As we now know, Canadians pay some of the highest drug prices in the world. But does it really have to be that way? That's the question I put to Federal Health Minister Jane Philpott.
Thank you. Pleasure to have you here.
Thanks for having me.
National Drug Plan first recommended in a 1964 Royal Commission on Health Services, more than 50 years ago, and yet today Canada remains with this fragmented system. Why is that the case?
Well, let me start by reminding you that I'm a family doctor. Been a family doctor for over 30 years, so you don't need to convince me that making sure Canadians have access to appropriate medications is absolutely essential. I certainly saw the challenges that Canadians faced and how they suffered and society suffers if people don't have access to medications. So it's absolutely essential, and the Prime Minister actually gave me a mandate to make sure that prescription medications are affordable, accessible, and appropriately prescribed.
1 in 10 Canadians cannot now afford their prescription drugs. That's great that in time you want to do something about it. What are you going to do to help these people?
I think one of the first things that we need to do is recognize the fact that we pay among the highest costs for drugs in the world, second highest per capita, second only to the United States. And in fact, nobody has touched this file for a very long time, and it's absolutely essential that we do so.
I spoke to a gentleman who's got brain tumors, who's now foregoing. He's not purchasing costly drugs because he wants to save the money to be able to provide for his family. He's making a life and death decision. Why is this happening in Canada?
Well, these are the kinds of reasons why we need to make sure that the decisions that are being made by provinces and territories right now, who are are currently responsible for making decisions on who is and isn't covered under a public plan, that those are fair, and we certainly know that this is an important decision that is being made across the country. My mandate, the things that are in my jurisdiction to control, are things like setting the prices, and that's the area where I think we will be able to make some dramatic results for Canadians.
Let me just get you this here. This is commonly used drug for hypertension, made by a Canadian company. This would cost $130 a year for Canadians to use. In New Zealand, it costs $10 a year. Doesn't that strike you that Canadians are getting gouged?
There's no question that the current status is not fair, that it's not right, that we are paying much higher prices than other countries are, and that's exactly what I'm working on. So for instance, you look at a drug for treatment of hepatitis C, for instance, and the price for it in Canada has been in the past astronomical compared to what's being paid in other countries. So we need to definitely look at ways that we recognize whether the systems are fair, whether the price is affordable that we're paying, whether or not it's in fact cost effective. And when it comes to things like antihypertensives or blood pressure pills that you're just talking about, there are all kinds of new drugs coming on the market on a regular basis, and they're not necessarily adding value but are contributing to the increasing prices that Canadians are paying for medications.
Why not follow the example that is seen in New Zealand, for example, where you would bring the private and the public plans together and use that leverage? 40% of Canadians are using private plans. That's the leverage that you could have to negotiate with pharmaceutical companies. Why not use it?
In terms of a universal payer and actually paying for all drugs, it would be irresponsible of us to lock in taxpayers, Canadians, to paying for prices that are far too high. So there's some work that has to be done if we were to even begin that conversation. Is first of all, let's get those prices down to a reasonable amount.
We had a company that just was looking into the private insurance plans, and they say that there's $3 billion of waste by these private insurance plans.
The reason that those private insurance plans are paying high prices, they're paying the second highest per capita costs in the world for pharmaceuticals, is because no federal government in recent years has paid attention to the price review mechanisms that we have in this country. And those price reviews were set up in a way that the deal was that it would be fair to Canadians, that the pharmaceutical companies that were being paid high prices would invest in research and development in increasing ways. We haven't actually seen that come true, and we have not continued to have a fair system. So I'm working actually quite determinedly with organizations within Canada that set the prices for prescription medications. And it's a little known fact that actually we have a lot of control over that. That with a few regulatory changes and guidance changes for this organization that does the price review on pharmaceuticals, that we can actually dramatically lower the cost of prescription drugs. There's something called the PMPRB, which is a big fancy bunch of letters, but what it means is a group of people who decide what prices Canadians, whether private or public, should pay for prescription drugs. One of the things that that particular group does is compares our drug prices with a set of 7 countries around the world. A couple of the countries that are in there, including the US and Germany, pay very high prices, the US in particular, much higher prices. And so we're comparing ourselves to this set of countries, which is probably not the right set of countries. If we were, for example, to change the set of 7 countries that we compared ourselves to and included in that list of countries, for instance, Australia and New Zealand instead, which are probably a lot better place for us to be comparing ourselves, there is evidence to show that we could bring down the cost of what Canadians pay for prescription drugs in the order of billions of dollars per year. No one has touched that for a very long time. I am really looking forward to some work that we're doing on that. We're consulting Canadians on it right at this moment.
You seem to be, reaching for all these different levers, and yet you won't go all the way to commit yourself to saying, why not go for a universal drug plan? We're the only country that has universal health care that doesn't have a prescription drug plan, a universal drug plan. Why not?
Well, I am working on a very important mandate, and my mandate is to make sure that drugs are affordable, accessible, and appropriately prescribed. No federal health minister has done that in recent years, and that's what we're working on. I'm determined to do that. It would be irresponsible of me and irresponsible of our government to lock in a commitment to universal, public paid pharmacare, paying the prices now that we do when we have the second highest per capita cost in the world. For us to even consider going to a place where we're going to say, yes, the public payer should actually cover these costs without making sure that we drive down those prices would be highly irresponsible. So the step that the Prime Minister has asked me to take during this mandate that I'm absolutely firmly committed to doing is to getting those prices down, getting them down into the zone that you've discussed in terms of what Australia and New Zealand are paying, which are much lower prices per capita than what we are paying in the country. That is the first step. It's going to take some time to do that, to make those regulatory changes. I think Canadians are going to be impressed with the work that we are doing. It's something that's not on anybody's radar, and the next person that asks about universal pharmacare, I would encourage you to ask them, what should the Canadian government be doing to drive down the cost of prescription drugs? This is a very important conversation that is not on most people's radars. We are going to be introducing some of this work in the coming months. Canadians are going to see that we are going to be able to save both public and private payers in the order of billions of dollars per year.
Thank you.